I developed a crossbite, so I didn't know if I would need surgery or not. I was a little nervous about trying it because I know it can be a big daunting issue.
I think we're so blessed just to be able to make friends with our patients. It's a special profession we're in.
I'm Dr. Scott Law, and I want to thank you for tuning in to the Smile Doctors Off Mute podcast. I'm super excited to announce today's guest. We have a special episode with Dr. Chris Mattingly and a special guest patient, John Hite. And oftentimes we just hear from doctors, but we don't get to hear a lot about the impact that has been made through orthodontics, through onto the patients' lives, and to hear their stories, to hear from their perspective. And so today, I just really want to welcome John. Thank you for joining us on the Smile Doctors Off Mute podcast.
Thanks for having me.
Yeah, absolutely. And Dr. Chris, as you're affectionately known, thank you for joining too.
Hey, my pleasure. Looking forward to it.
All right. Did I get that right? Are you known as Dr. Chris, or no? Am I making this up?
No, you got it. Yeah.
Okay. All right.
With Chris Howell, my partner's first name's Chris too. So
you guys go by both? All right. Okay. Want to make
he's
sure.
Dr. Howell, and I get to be Dr. Chris.
Okay, perfect. That's what I thought. All right. Awesome. Well, you know what? I will save the introductions. I want you two to introduce one another. Would you guys mind doing that? John, would you mind introducing Dr. Chris, who he is for you?
Sure. Dr. Chris was my orthodontist, and it was a little over 2 years ago, I think, that I came into the office to see him. And so I've seen him at every visit over the years. And I hadn't worked with the orthodontist in a while, so I was happy to work with Dr. Chris.
Love it. And then, so how did your paths first cross, Dr. Chris?
Well, John came in for an exam, and you were immediately drawn to him. He's such a kind, humble guy that you just know sometimes that you're with special people, and I knew that with John. And I'll let John kind of explain his particular situation, but from an orthodontic standpoint, he had a pretty significant situation, crossbite, due to some skeletal issues and some underlying issues, and it was going to be a challenge. It was going to be a challenge to treat non-surgically, and we talked about the possibility of that, but we decided we'd take a swing at it non-surgically, and with excellent cooperation. And I thought there was a reasonable chance, and his progress throughout treatment just exceeded every expectation. John did anything and everything he asked of him, which didn't surprise me at all. And every visit was just a joy catching up what was going on him, both in his life and in his medical journey as well. So I'll let John fill you in all that. But it was just true pleasure from day.
Love it. John, we'd love to hear what caused you to look into treatment.
I hadn't been to the dentist in longer than I want to admit. And I went in end of 2021, beginning of 2022. And that was when she told me, the dental hygienist said, you have a pretty bad crossbite, and it's causing some issues with your gums. She kind of recommended, she said, I would look into it if I were you. And so I looked at a couple different orthodontists in town, and I decided to go to Dr. Chris, or Dr. Mattingly, as I call him. So to avoid the confusion with the other doctor. But so I went over there, and I wanted to try Invisalign because I had tried braces before, and I really didn't want to go through that again. And I knew that they were the only place here in the small town we live in that did Invisalign. So I wanted to try that, and I thought I would give their office a try, and it worked out great.
I love it. So, you know what? Let's back up a little bit. So, Dr. Mattingly, what got you into ortho? What caused you to go to pursue this path of becoming an orthodontist?
Well, for me, that's an easy one to answer because my dad was an orthodontist, and kind of grew up in the office, started doing tracing cephs at home, and then doing trimming models and doing lab work. So all the summers during college. So it was an easy move. I got to see, the tenor of the office and just how great it was working with the team of wonderful people that enjoy being with each other every day, and just see the relationships they form with families and patients. And it was a no-brainer at that point, and actually had the blessing of working with my dad for 15 years, which before he retired, which was truly one of the blessings of my life.
Oh, wow. That's awesome. What about what's your treatment philosophy, and how do you engage with patients, and what impact do you try and have on the lives of your patients?
Treatment philosophy is, fairly standard orthodontics, but we've always, like a lot of practices, we've always tried to put the patient first and foremost in center. And I think we're so blessed just to be able to make friends with our patients, to get to know them, to follow them through. Sometimes it's a one person in a family like John. Other times it's kids, and then moms becomes a patient. And really, I say often the hardest part of our job is saying goodbye at times.
Yeah.
You get to know people so well, and then, you're going to see them for a retainer check, but it's going to be a while. And then at some point, those teenagers are going to go away to college, and they're going to get busy with their life, and you may or may not see them, but, you never forget them, and you hope you make an impression. You hope you, in some way, are a positive influence on our lives. And it's a special profession, Maureen.
It is beautiful. I love the connection with patients, and John, again, I want to thank you for being on to share your side of the story of this. This is awesome. So, what was your life like before you started treatment? What were you feeling? What were you struggling with? What did things look like?
So I have a very rare genetic neuromuscular disorder. So I've had that since birth, and it's been a lot of ups and downs. Use a wheelchair for long distances, and I'm able to walk short distances. I take treatment for it now, which has really helped my quality of life, and that's made a big difference. And so I had braces in high school, just relating to the orthodontia issue, and they worked great, and for like 3.5 years, I think. And that was just kind of a standard issue that I needed to have fixed, just like a lot of people do. But then after high school, I went to college. I didn't do as well wearing my retainer as I should have, and developed more scoliosis from the weakness from the neuromuscular disorder that I have, which you can probably see here on camera. And and as that happened, like Dr. Mattingly mentioned, I developed a crossbite. So I needed to have that fixed, and wasn't sure if it was going to happen. Like Dr. Mattingly said, I didn't know if I would need surgery or not. And I wanted to come in and give you guys a try, and the orientation went great with him. And I was a little nervous about trying it because I know it can be a big daunting issue, but it worked great.
Yeah, cool. So knowing what you know now, what would you have told yourself before coming in?
Do it sooner, because I've developed some gum recession from the crossbite that I'll probably have to get fixed at some point. So that's going to be another issue. But I wish I had done it sooner. Yeah, I kind of let it go, and I guess I was nervous about going in and having more. We'll have to add a few medical procedures, not a lot, but it's always intimidating. And going in and working with Dr. Mattingly and the smile doctors and everything, it was so easy. And like Dr. Mattingly said, they're so good with the patients. I wish I had done it sooner, because it's you have to keep up with it. Like you said, you have to have the good cooperation, but the process other than that was really easy and was awesome to do.
I love it. So when you go in, what'd you look forward to?
Well, I wanted to meet Dr. Mattingly and talk to him, because I wanted to see what he had to say. And like I said, I was nervous going in. So it was nice that everybody in the office was nice and very, very helpful with me. And Dr. Mattingly, especially with the consultation that we had, and him explaining everything and willing to give me a try. It made a big difference, because I was nervous about trying it. I wasn't sure if it would work, and I'm nervous about doing another couple of years with stuff on your teeth, because I've done it before, and it's painful and not actually this wasn't that bad at all, but it's just a lot of upkeep, and that can be intimidating to do, but it was worth it.
That's great. That's great. And so when you go in, I'm not sure the flow of your office, Dr. Mattingly, but do you get to see, John, different assistants each time, or is it kind of the same one?
It was, I saw a couple different, and there was a couple repeats, but I saw a couple different assistants, and well, I guess Dr. Mattingly, what is that right? Is that the right word for the women that?
Yeah, chairside assistants. Okay. You would see different ones.
Yeah. I want to make sure that's what. So and even the office staff were great when I needed scheduling. I had a few scheduling issues over the years, but yeah, everybody was great, very helpful, because this can be. I was nervous about doing it because you have to scan every week, and I wanted to make sure I was doing it right. And everybody was very helpful with informing me on what to do and issues that people might have had before, and little tips here and there about how to do it correctly. And that was really helpful and really assuring.
Well, I love it that you're able to get such a great finish and result doing it with the, non-surgically.
Right. And
I tip my hat to both of you, for Dr. Mattingly for treatment plan and diagnosis and going through and the mechanics to get there. And then John, you being so diligent and wearing your aligners and just making sure that you did it. Yeah. Great. And great job.
With the other health issues that I have, I really wanted to avoid surgery. So this was a big godsend for me to be able to do it this way.
Love that. How's your life been different since? You don't have to wear the aligners all day.
Right.
That's one
right.
thing.
Although
what else?
Like I told Dr. Mattingly when I first got them off, you get used to it. You feel a little bit weird without them. And I do have to admit, this is kind of a bad thing on my part, but I've been snacking more, which I shouldn't do because I kept them in. I went to the dentist while I had them on, and the dental hygienist that was seeing me said, "Have you noticed that you lost weight with the Invisalign?" I said, "Yeah, I think I have." And she said, "Everybody does, because nobody wants to take them off to like snack." So that was that's something I'm going to have to get back in the habit of doing, of not having too many, because I have a bad sweet tooth. But but everything else has been fine. Yeah, it feels great. You just feel the alignment day to day when you're just going about your business. And I think, I was never really self-conscious about the look. That wasn't really what I was. This was more of a functional thing, but that was kind of a secondary issue. And I'm happy to have that taken care of too, because you just feel a little bit better knowing that your teeth are straight and it looks better.
Yeah. Yeah, and you got a great smile. That's awesome. So, Dr. Mattingly, so it sounds like John had multiple assistants, chairside assistants, and everybody loved to have him come in the office. And I would venture a guess that they were kind of fighting in line to see who would see him that day. Tell me a little bit about your experience on the treatment end.
Yeah, you know how the office works, Scott, because you've been there. Yep. That's exactly right. When there's, we're blessed with tons of patients like John that, when you see their name on the schedule, it makes you happy knowing you're going to see them that day. And every assistant would want to work on John. But with Invisalign and with small doctors anywhere, John didn't make that many appointments to the office.
True.
I mean, this whole journey probably was 10 appointments, John, beginning to end, or something like that.
Yeah, that might be on the high end. It might have been
probably the high
like
side,
6 or 8, maybe. Yeah.
Yeah. Did you do 2 different sets of trays or 3? Do you remember? I know we did your first.
I did 3.
3. So 2 refinements, probably 8 appointments beginning to end, which, when John would come in the office, his musculoskeletal situation is it's a big deal in his life, obviously, but John carries himself so well, it's not something that jumps out and grabs you by any means.
Right.
But sometimes after the appointment, he would sit out in the waiting room for 10 or 20 minutes. And, I never knew if he was just kind of catching his energy or if he was waiting on a ride. But it was a challenge for him to get to the office, needs to say. So, that eight appointment, whatever it was, to go from, a full crossbite. And one of the reasons that we even attempted non-surgical, I mean, there were a lot of reasons. John wasn't going to do a surgical treatment for good reasons. But with the scoliosis, his head kind of was always cocked to the side, and it seems like it was much more when I first met you, John, than it is now. I noticed at the last couple of appointments. I'm noticing that on camera. I don't know if that's the treatment you're taking for that.
A little bit of both. I've been trying to work on it. It's just a lot to deal with the muscular weakness on one side. You're always kind of fighting it, and I need to be better about that too. Like physical therapy stuff that they've given me at home to help with that. Yeah. But and then that's the reason the teeth moved was because of the issues with scoliosis. And
okay.
But it also gave me a fairly decent hope that it wasn't so much a skeletal crossbite as maybe a positional and reactive crossbite to the scoliosis. And so the crossbite correction happened in the first set of aligners. I mean, I was amazed at how well it worked. And then the last two were just refining some things. But yeah, so the John was great to have in the office. It just didn't happen often enough from our standpoint, but it really was for quality of life for him. Because where do you live? You're in Springfield for 30 minutes
I'm
away?
not that far away, but it's 15 minutes, maybe a little more, 20. Yeah. So.
Sure.
Yeah. So not a bad trip.
No.
But yeah, the less trips he made in, I'm sure the easier it was for him.
Yeah, I would agree. I think patients, listen, John, I'll tell you a secret. As orthodontists, we feel our patients love us and they all want to come in every day to see us. But in reality, we know, yes, life is busy. Right. And if people don't have to come in, then it's so much better to not have to come in and still achieve the high level of care. Mm-hmm. We're here anytime patients do need to come in. And yeah, there's occasions throughout treatment, just like with you've experienced, we need to bring patients in and physically see them, work on them. But man, to be able to not have you have to come in for so frequently, right. We just find our patients love that, right. And love having us in their back pocket on the app, right. And to ask questions and do whatever.
Yeah, that was very handy. There was a couple of times when I had questions, and just being able to send it on the app was very helpful. Because Dr. Mattingly's office isn't open all week; it's only a couple of days a week here in town. Otherwise, I would have to go, like he said, even over an hour to see him. So that was very helpful and very convenient, especially if there were times when I wasn't feeling that good and didn't feel like getting out.
Totally. Well, I have some questions for both of you, so feel free to jump in. But what has this journey overall meant to you?
I'll let you go first, Dr. Mattingly.
Well, let me answer that from two perspectives. It's always heartwarming to meet a patient and set out expectations, but you're never 100% sure if you're going to meet them or not. It takes a lot of cooperation. A lot of good things have to happen. So with John, we kind of laid out the pie in the sky treatment options, and then when we achieve them, which doesn't always happen, but in John's case, because he did such a great job, it just makes you so satisfied, so happy, so thankful that you've had this opportunity to meet a friend, to provide a service that, hopefully exceeded their expectations, and to see something come together like that. So that's one. Number two was when I first saw John, it was just a normal consultation. I think my treatment coordinator went over the cost of the treatment and all of that. But then we got busy behind the scenes because Smile Doctors has a program called Smiles from the Heart. And I left saying, hey, if there's anybody that I'd love to see be part of this program, it would be John. But I think it was capped out at age 19. So do a little research. That's true. It is capped out at age 19. But all it took was one email. And within days, we got, sure, we'll make the exception. We'll do this for this patient, as if you feel it's important. And we were able to call John back and say, we're going to treat you pro bono. And, the fact that Smile Doctors is willing to, bend the program a little to make it work for somebody wonderful, it's just so heartwarming.
I love that. Thank you for sharing that. John, what about you?
The same thing. I guess like you said, I'll take it a couple different ways. It's helped with, like I said, with the smile. I like having the normal smile that looks good with the teeth, and then mainly the functionality, because I can tell a difference with the crossbite gone, and that's a good feeling. And knowing that I have it taken care of now, and I don't have to worry about any more issues down the road as far as any more grinding on teeth or any more gum recession. That's a big thing off my shoulders that I don't have to worry about any more issues with that, which was, I didn't even really realize what was going on until the dental hygienist told me, and then she kind of filled me in on how bad that can be if you don't get it taken care of. So to have that taken care of is huge for me. And then, like Dr. Mattingly said, with the program that you guys have, that was really, really big because I didn't start my I really haven't worked that much at all. And so, a couple $1,000s is a lot of money for somebody who doesn't have a job. I have family support, which I'm very grateful for. But so I did start working part-time during the treatment, but it was very late in the treatment. And that, a lot of money to pay for the Invisalign and everything would have been tough because, like I said, I don't work and I have some money with medicine and stuff like that I have to use. Mm-hmm. So being able to have that taken care of was really big for me. I was very, very thankful because I was talking with my parents about when I first saw the consultation, I saw how much it was going to be, about how we would swing it and, how much would mom help me with or how much would dad help me with if they were able to do it a month to pay it off. And so when Dr. Mattingly contacted me again and said that you guys would help me with the payments and I'd be able to do it pro bono, that was huge because I wasn't sure how I would be able to afford it without that. So that was really, really big.
I love that. Thank you for sharing that.
Yeah.
Can I ask a question with John real quick?
Love it.
John, have you been back to see your dentist and that hygienist since treatment ended? I don't know the rest of that. What were they? What was there?
She said it looked great. She gave me a recommendation for a cosmetic I don't know the word for the cosmetic like gum doctor here around to do if I needed to have like the gum recession issues, the graft, But she said that other than that, everything looks great, and that the issues with the uneven pressure on the teeth from the crossbite and everything looks like it should be taken care of now, and I won't have any more issues from that. So that was great.
Well, that is awesome. That is awesome.
Yeah.
I got another question for both of you. What do you admire about one another after having gone through this together?
Well, I really appreciate how helpful Dr. Mattingly has been and how nice he's been. Always joyful to see in the office. He always asks me how everything's going, and I try and ask him about what's going on with family. We talked about vacations that he might be on or stuff he might be doing with his grandkids. But it's always nice to have a rapport like that with somebody. You just feel more comfortable. And I always look forward to going to see Dr. Mattingly, and professional with everything we did, and always willing to help me out, above and beyond. He said if I need anything, because I didn't see him, like we said before, I didn't see him very often, or it might be 4 or 6 months between visits. He always made sure that I was call, send a message, or come up to the office if I need it. And they were always more than willing to help me out. And I really appreciate that from Dr. Mattingly.
Well, with John, it's just his perseverance and his determination. I mean, everybody's got some struggles in their life, but John's had more to share, and there's no sugarcoating that. That's but he's just got a great personality, optimism, willingness to try. I wish I had what he has most of the time, and I wish we all did because. It's special. So he touches your heart when you're around him every time. And, he'd leave and I'd go home and tell my wife about the appointment sometimes. And just, it always made an impression on our day.
I think, I want to say, I think that helped because it's easy to get down when you have a lot of physical issues. And I certainly don't have as much as other people. So I was a little bit discouraged about when I found about the crossbite and how I would be able to address it with orthodonture, because I knew that would be another probably a couple of years that I'd already done before. I didn't want to do it again. So when I saw Dr. Mattingly and everything went so well, that helped a lot with staying positive. He was very positive with me and said not how easy, but that it was doable and we would try it, and he gave me a good outlook on it. So that helped a lot, because like Dr. Mattingly said, you can kind of get down sometimes with certain things. So to have him be so supportive, that helped a lot. And then I didn't feel as bad. It didn't feel as intimidating. And I remember leaving the office that day with the consultation feeling, and especially the second time when I went back and saw him, and he told me that you guys would pay for it. I felt more optimistic, I guess, and positive about how things would go. And it didn't feel so discouraging, I guess, because I knew that I would be able to hopefully have it taken care of. And that made a big difference.
I love that. It sounds like you both truly inspired one another. So what a beautiful thing. This is what we always hope for in the doctor-patient relationship. And John, it sounds like you were just an amazing patient. You are an amazing person. And just the diligence that it takes to do a correction using Invisalign, you have to be very, very consistent. And I think that's one of the things that you're blessed with doing, that you've learned through your challenges, is that consistency, that diligent, that hard work that you apply yourself towards. And so just congratulations on this outcome and this result. Just
thank you.
Awesome.
Thank you. Yeah. Well, I can't say thank you to you all enough. It was with Dr. Mattingly and Smile Doctors able to help me out. It helped. I can't tell you how much it was a relief and help to me to be able to work with you guys through everything.
That is awesome. Well, we truly feel where much is given, much is required. And so we've been blessed to be able to do this and help people. And so we love helping great people. So great job. Dr. Chris, if a younger orthodontist came to you to say, how do I create this kind of experience? What advice would you give to them?
Really it's to put away everything you learned in school and just look at the heart of people and really try to make a connection. Forget about the teeth, that's important. But, understand that everybody's got a story to tell, and first impressions don't mean much. You got to get to know people. You got to try to understand what's behind them. With John, it was easy but we run into challenging patients. We have new patient exams that send up tons of red flags, but everybody's got a story, and sometimes you just got to understand it and see them differently, and then all of a sudden those barriers break down pretty quickly. Not always, but often. So a new resident would be lucky, or a new orthodontist would be lucky if they ran into John every day. But the real challenges are elsewhere in our profession.
And I want to give Dr. Mattingly a compliment, because I've seen several doctors, and not all of them, varying degrees of bedside manner, but Dr. Mattingly has really good chairside manner, I guess I should say, rather than bedside manner. And that meant a lot.
Oh, it's beautiful. Thank you. John, well, thank you for joining us. Thank you for telling your story and sharing with us. John, I would love it if you had your own podcast. I think you'd be gifted at it, and in interviewing people and sharing, pulling out of them what's meaningful to them, and sharing your own story in the process and inspiring a lot of people.
Thank you.
It'd be awesome.
I'm a podcast junkie. That's pretty much all I do nowadays, is watch and listen to podcasts. This is my first time being on one, so I was excited to try it.
Okay, good. Well, I hope it's not your last. I think you could do a lot of great things with it.
Thanks.
Yeah, thank you both for joining us today. This is awesome and inspiring, and we hope that more people in our profession can do this for others and pay things forward and really impact and touch the lives of those that we serve. So thank you both, and appreciate the difference you're making in others. Thanks.
Thank you.
Thanks, John. Thanks for being on. Thanks, Scott.
Thanks for having me. Happy to work with Dr. Chris.